when I talk to physicians about encouraging patients to get booster shots, first of all, it's important to note that there are measurable benefits at the individual level for making it harder to get infected or reinfected and less likely that someone will get severely ill if they're boosted compared to even finishing their primary vaccine schedule. Much of the initial defense against getting infected depends on antibodies that are secreted into our nose and into our airways that help to bind virus that we might inhale and help protect our cells from getting infected. On the other hand, after someone gets infected, they can get seriously ill. Clearing the infection and limiting the inflammatory response depend on more than just antibodies. It depends on things like lymphocytes, T cells, and B cells, and other components of what we call adaptive immunity. And what we've learned through the pandemic is that vaccination and previous infection also stimulate a memory to our adaptive immune system. And so not only do we have antibodies that help guard against infection and wane over time, we also have a much more complex immune response that protects us from reinfection, protects us against getting severely ill, protects us from dying. And it turns out that that more complicated defense against serious COVID-19 lasts longer, particularly after we've gone through a series of vaccinations and, for those eligible, booster shots. So what we're seeing is waning protection against getting infected, but a much more robust defense that's longer lasting, more durable, but still wanes over time against serious COVID-19, getting hospitalized or worse. At least one study looked at antibodies produced by people who were infected with the Omicron variant, showed that those antibodies in a petri dish setting in the laboratory were quite good at preventing infection by the Omicron variant, but they weren't that protective against Delta or the Alpha variant. And that is important because the Omicron variant is different enough that the immune response that it elicits in us is pretty specific for Omicron. And that means we don't know how protective it will be if we get a variant that is significantly different from Omicron in the future. However, those same studies showed that for people who had also been vaccinated, that when they got infected with Omicron, that infection stimulated a very broad, robust immune response that still protected in the petri dish against Delta and Alpha, and is likely to be protective against different variants moving forward. So I, of course, would never wish for anybody to get COVID-19. What I would say is that if someone is going to get COVID-19, I certainly hope that they're vaccinated, because not only will they be protected from doing poorly with COVID-19, they're also going to experience a more robust boost effect of that infection that should have better protection against new variants than simply getting infected in the absence of background vaccination. We do talk about how some booster shots may be less effective than others, but to be honest, the booster shots that we have available are all capable of providing individual protection to the recipient, but on a population level, it makes it harder for SARS-CoV-2 to spread. And when the virus is challenged to spread, it makes it less likely in a given population that we will see the emergence of variants. So I think the main message for boosters is we just need to get them rolled out as much as we can, and less about the nuance between how one booster may be more durable than another.